What's the point of med school? Med school is a 4-year commitment in the US at least, and it basically explores everything that has to do with medicine, right? Well, that's what you would expect, right? And obviously, we do learn a lot. We learn all the different processes that occur in the body, or most of them. Obviously, you can't know everything. And then we get tested on that. Then we rotate through all these specialties. Then we get tested again. And then we take some electives, and then we go into residency. Then we get tested again. And then you get your fellowship, and then you get tested again. There's so many steps that are involved in med school and the process of becoming a physician. And it's not surprising that there's a lot of people that really do not like the process of med school. And everyone just says, just get through med school. It doesn't really matter where you go to med school, it just matters where you get into residency and yada, yada, yada. Really, the point of med school is not to basically teach you everything, but it's kind of how to learn. How to learn about the processes that occur in the body, how to learn how to become a better communicator with the patient in front of you, and how to manage the system that's around you so you could utilize it for any future problems that may occur. And when I say all of this, it's kind of a nod to the educational system in America in general. The point of school is not necessarily to teach you everything. It's not necessarily teaching you about calculus and how to find the integral under a curve, yada, yada, yada. But it's about how to utilize strategic thinking and how to look at a problem, look at it and say, okay, I know how to approach this using the tools that I have in order to solve a problem. And it may seem like there is a curriculum that you need to get through, and you definitely need to learn these aspects. And I'm not doubting that. Those are definitely part of just general knowledge that you should know. But the point of school in general, no matter what class you go to, is to learn about what kind of tools you have, how to organize them in the toolbox, which is your mind, and how to use those tools effectively when you come across a problem. And now that problem may already have been seen before, and you could, utilize those tools and fix the problem or solve the problem pretty quickly. Or it could be an entirely new problem you need to manage, how to use what you have, what knowledge you have, what previous experiences you have in order to tackle the problem. Now, when we transition that into medicine, medicine is like a whole other ballgame, right? There's actually lives at stake. You can't really just, fix a problem and hope that it will get better just willy-nilly, blindly. And that's where medicine's previous knowledge bank really did. Medicine in general, science in general, comes from the point of view of evidence-based treatment. So in terms of evidence-based treatments, there have been clinical trials run in the past. There have been basic research that's done in the past. And all of those are put together by organizations that tell us these are the therapeutic strategies that are proven to be most effective and recommended for this subset of population or things like that, and basically the best practices that need to be used in order to treat a specific condition. So when we put that in terms of med school, let's look at the structure of med school. So med school is typically 4 years in the US. First 2 years are didactic, which basically means classes, lectures, and you basically listen to professors and take notes. Then you get an exam called step 1, where you basically have to show that you learned all that. And then the third year comes around, and that's when you actually go into clinic. That's when you go into the hospital and start utilizing what you've learned into the real world. But the thing is, people will tell you all the time that what you learn in the first 2 years barely gets used in the third year. In the third year, you're learning more about how the system works rather than the actual medicine. Yeah, you will learn a lot about the medicine. You will learn basically the little nitty-gritties of everything. And you will think back to your first 2 years and think about, okay, that kind of relates to that. And I see where they're coming from. I recognize this medication and I know its mechanism of action. But then once you come into your third year, you basically try to understand how all of that is actually played into becoming a physician. Now, I've yet to experience that myself, and I hope to experience this in a humble way, because I've heard lots of stories about people who become very fatigued and people that have become, their lives are just entrenched into this sort of lifestyle of constantly thinking, constantly caring for people without actually caring for them. And it becomes a situation where you are at a point in your career where it's like the final hurdle or something like that. And you just need to show that you are able to think clearly, think in an organized way that you will be able to put those skills that you learned into an applicable setting, into an applicable way of thinking. Because at the end of the day, even your attending physicians don't know everything. Yeah, they've seen a bunch of things before, but that comes with that recognition, that pattern recognition. And a lot of medicine is like that. You actually don't really know what to do unless you've seen it a bunch of times and you've done it yourself. And there's a lot of help that comes along with that process. And in your third year, you actually don't even learn everything. Like you go through specific rotations, but all those rotations are not what everything medicine has to offer. Like you don't do derm rotations. So, but that's what kind of like your fourth year is. That's when you do electives, and that's what you do things that kind of like interest you, along with some other requirements and capstone things. That's what kind of like your fourth year is, just to like fill in the gaps and think about what's like interesting to you. And that's basically what the entirety of med school is to understand all the basic science. That's the first 2 years. How to apply all of that in a way that is actually applicable, and then you just fill in the gaps at the end. And you get tested along the way, obviously, because there needs to be some way of standardizing it. That's basically what the point of med school is. And if that does sound interesting to you, if you're just starting out in your med school journey, or you're thinking about applying to med school, think about that, because you are a lifelong learner in medicine. You are practicing medicine. You're never mastered medicine, because there's always something to learn. There's always things that are changing. And that's what science is all about. There are going to be times when things are changing, and it is up to the people that have studied it to understand that it's a good thing. That if you're stuck in something that's constantly the same, then you're never actually learning. You're never actually evolving. You're never actually getting better. And you're not actually helping people at the end. So hopefully that helps to understand like what the point of med school is. And I hope that you found that interesting. So if you did, please leave a like and consider subscribing. And yeah, I'll see you next time. Thanks.